So one of the most commonly asked questions I get is, what the heck should I be eating to help with my migraines? So I wanted to jump on here since we've been talking a little bit this week about diet and the holidays and how that impacts your migraine. So if you're not familiar with me, my name is Dr. Tanya Paynter. I am the founder of Migraine Mastery, and I just really wanted to make sure that you guys had a little bit of support through the holidays, what to eat, how to eat, to enjoy yourself a little bit more and hopefully not suffer the consequences of it. So the question that I get a lot is how do I know what I should be eating? There's so many different diets for migraine. There's the elimination diet, a whole food diet, low histamine, low tyramine, anti-inflammatory, grain-free, carnivore. There's a lot of options out there, and all of them work very, very well. It just depends on which one works for you. So how can you tell which one you need? And that's the big question, right? You can trial and error through all the different ones, but that gets really frustrating. And sometimes what I see quite frequently actually is that you will try an anti-inflammatory diet and it'll work for a month or two, and then your migraines start coming back. So dietary changes can be really important and can be very helpful. But if there aren't other things that go along with it, or if it's not the diet that's right for your body, you're going to see symptoms coming back. And so this is kind of the tricky part of how do you know which one is right for you? So there's two ways of going about doing this. One is just symptom tracking, understanding what your symptoms are telling you about your migraines. So this is something that I talk about a lot, is understanding what are some of the things that happen with your migraines and with your different migraines, right? So if you've followed me for any length of time, you know that you likely have more than one kind of migraine happening if you have been diagnosed with chronic migraine, right? So there could be the hormonal migraine, there can be a weather triggered migraine, there can be the migraine that comes with, depression, anxiety, and then the migraine that is just overwhelming fatigue, but doesn't come with mood issues. All of those are different types of migraines, right? And so as we become aware of the symptoms involved with each particular migraine, we start to understand some of the patterns that are emerging about them. And this is really, really important, because if you start noticing that you have a lot of anxiety and heart palpitations and just feel very on edge when you're having a migraine come on, or if a migraine comes on right when you're starting to get into, say, an argument or have some sort of a kind of an adrenaline rush, and that will trigger a migraine. If you're always feeling, irritable and snappish, and it's not really related to the pain, but it's related to the migraine itself as kind of a prodrome. A lot of people can tell their mood changes before their migraine hits. Those are all indicators that a low tyramine diet could be very helpful, because tyramine is a precursor to our catecholamines, and our catecholamines are our stress neurotransmitters. So anything that causes stress or makes us feel stressed is and that's part of your migraine syndrome, that is likely going to be playing a role. So that would be one that would be good to try. Now, on the other hand, if you feel like you're allergic to the outdoors, everything, you have allergies to everything, you have lots of runny nose and runny sniffly nose and itchy eye, you break out in hives, or you have other immune reactions to things, you get a lot of skin issues, those are all pointing to histamine as being an underlying problem. And so then a low histamine diet can be very good. So you can see that we can kind of pick out the symptoms that go along with your migraines to really help you understand the kind of diet that you're going to need. Now, sometimes it can be pretty easy to say, you look at, well, what symptoms would mean that I have to go on a low histamine or a low tyramine or a low arginine or whatever. You can Google that and say, okay, well, what do high levels of these things look like? Like, what are the symptoms? And, oh yeah, I have that, and that. So you can definitely do that. You can try, just the trial and error option. That's always an option as well. And then you can go to somebody who already kind of knows these things, and we can pick it out pretty quickly. So, the Migraine Mastery team, a lot of naturopathic doctors can be helpful in that. Functional medicine doctors can be helpful in that. So giving them a list of your symptoms, not even migraine related, but just your general symptoms, that can really help to pull out, all right, these are some underlying issues that we know contribute to migraine. but that are also contributing to some of your other symptoms as well. And we put that all together in one pretty package. That is your health picture, right? So, so any of those options are going to be fine. You're going to save time and stress if you find somebody who can help you figure things out. But there are a ton of resources online as well for you. So you can just kind of Google it and do a little Google researching and see if you can't come up with a couple of those things that might be problematic for you. So I mentioned two things. So one is the symptom tracking, right? To try to figure things out. Number two is testing. So there are multiple types of tests out there. There are immune specific tests. There's a test that I'm going to tell you about in a minute that I recently learned about that's actually really awesome. But the food testing is going to take a look at common immune reactions to food, IgG, IgA, and maybe IgE, but more commonly it's IgG and IgA. So if you don't know what I'm talking about with those letters, it's basically the branch of the immune system that's involved with the reaction, right? So if it's an IgE reaction, we're looking at, an allergic reaction. Like I get a bee sting, I go to the hospital or I'm going to die, right? That's an IgE reaction to the extreme. An IgG reaction is something that is not correlated with any particular syndrome. Like if you have an allergic reaction, you know it, right? It's very diagnosable. Everybody has the same symptoms, and here's how you treat it, right? Cut and dry, very clear cut. But when it comes to IgG, there is no clear cut. For some people, it causes joint pain. For some people, it causes brain fog and mood issues. For some people, it causes problems sleeping. For others, it causes fatigue. Or you can have a blend of any of those. And then it can happen either right after you eat the food or up to 5 days later before you actually start having symptoms as a result. So these can be really tricky to figure out unless you're looking specifically for, those patterns. Potentially 4 days after you eat something, is it triggering something? So this one's a little harder to figure out just by tracking, although it can be done. But testing is going to be a quick and easy shortcut. Of course, instead of a time investment, it's more of a money investment, right? These types of tests are not covered by insurance. And it's a specialty test that you'd have to go to, again, a functional medicine or a naturopathic doctor to have done. It's in some cases, it's a blood testing. And in some cases, it's saliva testing. So one of the tests that I recently found out about that I thought was really cool, it does both. It's measuring IgG and IgA reactions to certain inflammatory foods. So it will let you know if any of these foods are causing an immune reaction so that you can cut them out of your diet. And that's fantastic, right? Super easy. You just provide some saliva sample and away you go. The other thing that it shows is markers for gut inflammation. It looks for potential infections. It looks for autoimmune diseases. It looks for absorption. So there are a ton of other things that this particular test done by a lab called Cyrex. I think it's called the Array 14 test. And again, this is not going to be an insurance covered thing, but it can give you a ton of information very quickly and help you to pinpoint problem areas. Because again, if you've watched any of my previous videos on gut health and the connection to migraine, it is supremely important that we address our gut health directly, because we now know that there's a direct link between the gut and the brain. And we also know that there is a direct link between inflammation in the gut as it contributes to migraine. And so that is one area to really pay attention to. And the testing can help take away some of the stress of trying to figure out what your food triggers are, so that you can kind of cut to the chase, get them out of there. And then again, as always, you have to work on addressing the healing aspect. It's great that you eliminate the foods that are triggering you. However, if you don't work on healing the gut after you've removed those, you're simply going to become reactive to different types of foods. And that's how we end up in this cycle of, oh, great, we eliminated gluten. I feel so much better. 2 months later, oh, shoot, they're back. Now what? Oh, I can't have dairy. So now you're gluten and dairy free. Great, feel better. And then a couple months later, shoot, they're back now. And oh, I can't have bananas now. And then I can't have chicken. And then I can't have pork. And then right? We get stuck into that cycle of eliminating all kinds of foods until we can't eat anymore. I talked about this on Tuesday. So that would be something that would be really important to take a look at, is doing the food testing, talking to your naturopathic doctor or a functional medicine doctor if you don't have one, either finding one locally or reach out to us here at Migraine Mastery. That's what we do. And we'd be happy to help figure out what is going on and what kind of diet you need for your body, and then help you move into that gut healing piece. So with that, I have some very exciting news that I will be announcing on Monday regarding the dietary piece and trying to help you guys figure some stuff out. So we've got a special offer for you guys on Monday. So make sure that you keep a lookout for that. And I hope you have a wonderful weekend. If you have any questions after watching this video, please feel free to type them out in the chat below. And feel free to share our video with anyone you know that might have migraines.